Amazing story to tell you about. You may want a number here. Autistic children spend their lives literally in their own world, unable to communicate effectively with even those who love them most. But I recently met with a mother of an autistic child, with that child and their doctor. The story, simply amazing. He's gone from being an autistic child to being an ordinary child. His name is Henry Drummond, and last year this adorable little 2-year-old was diagnosed with autism.
What did you think when you heard that?
It was the worst day of my life.
But long before that, his mom, Kim, knew something was wrong.
He didn't make any sounds, really. He babbled very infrequently. He was very withdrawn, didn't make eye contact with anybody.
That was a year ago.
What's she doing? She's sleeping, that's right.
And now?
And the neurologist says that she honestly feels that he is rapidly outgrowing his diagnosis, that he is learning now as a normal child, which is the biggest hurdle. His language is now age appropriate.
In fact, there are few, if any, signs of autism.
Can you point to the yellow? Yes.
So how did it happen? Dr. Karima Hirani of the Wellness Center in West Los Angeles treats Henry and a few dozen other autistic children. Nutrition is the key.
We put them on a gluten-free, casein-free diet. That's one of the first things that we do. And when these parents have been interviewed, about 60% of them will respond and say that they saw a big difference in their children. Gluten is a protein that's found in grains such as wheat, oats, rye, spelt, and barley. Casein is found in most dairy products, so they seem to have an opioid effect on the brain, which explains why these children are sometimes, like they're in their own world.
But Dr. Hirani's program consists of much more than just a diet. Patients are tested for amino and fatty acid deficiencies, as well as mineral deficiencies, excessive yeast, and any possible parasites in the intestines. When appropriate, the child is then put on a specialized multivitamin therapy, especially high in vitamin B6 and magnesium.
So we start them on various different vitamins, and I also put them on vitamin B12 injections, which seems to really help with their focus.
Their focus and their speech.
I just saw a young boy, 2.5-year-old. He has gone from speaking 10 words to 75 words.
In 2 months?
In 1 month.
In 1 month. As for Henry,
his prognosis is extremely good for maybe a normal life.
Okay. And you say that with hesitation.
It's hard to believe that that's a possibility. In one of the autism books, it says if a monster's ever knocked at your door, you're always looking out the window.
So it's hard to believe.
It's very hard to believe.
Hard to believe, but true. For more information on this story, you can call Dr. Hirani's office at area code 310-577-0753. Again, that number is 310-577-0753. Kim Drummond, Henry's mom, says giving supplements to a young child is not easy at all, in addition to receiving physical and occupational therapy. But she says the outcome is certainly worth it. This really is amazing. As you know, I've done a ton of stories on autism.
Yeah.
This is absolutely incredible.
How strict do you have to be with that diet? I mean, can you veer off by accident, or does it have adverse effects?
Well, you have to be strict, and the doctor makes a point of saying that compliance is very, very important. Also important is getting the kids in at a young age. In covering this, that's the one common denominator amongst all the doctors who treat autism. Get them in early. If you even think that your child has autism with delayed speech, some of the symptoms you just heard there, get them into a doctor. Worst case scenario, they'll just send you home and say, come back in another few months. But getting them in early helps with the treatment. But you do have to be strict about this diet, and it's not easy. And the mother told us that. But she said, obviously she has a normal, beautiful 2-year-old son now.
Great.
So
Very promising. Thank you, Dilla.